Hi everyone, and welcome back. Today's lesson focuses on infections that affect three major internal systems: the blood, the heart and blood vessels, and the lymphatic system. These infections are serious. Some can become life-threatening in a matter of hours, so early detection and nursing care are absolutely critical. All right, let's dive right into Chapter 11, Infections of the Blood. First, let's talk about the role of blood in infection. The blood isn't just for oxygen and nutrients, it's also a highway for immune cells. But when bacteria, viruses, or parasites get in, the bloodstream can become a dangerous place. Next up, we have septicemia and bacteremia. Bacteremia means bacteria in the blood. This can be transient or lead to septicemia, where bacteria multiply and trigger systemic inflammation. This can escalate to septic shock, with dangerously low blood pressure and organ failure. Let's not forget about endotoxins and cytokine storms. Gram-negative bacteria release endotoxins, which overstimulate the immune system. This leads to a cytokine storm, where inflammatory signals spiral out of control, causing tissue damage and shock. And yes, blood can also carry parasites like Plasmodium, which causes malaria, and Trypanosoma, responsible for Chagas disease or sleeping sickness. These are vector-borne and have major global impact. Now on to Chapter 12, Cardiovascular Infections. First, we have endocarditis. Endocarditis is an infection of the inner lining of the heart, especially the valves. It's usually caused by Staph aureus or Strep viridans, especially in patients with artificial valves or IV drug use. Symptoms include fever, heart murmur, and Janeway lesions on palms or soles. Then we have myocarditis and pericarditis. Myocarditis is inflammation of the heart muscle itself. Pericarditis affects the outer membrane. Both may be viral or bacterial and can cause chest pain, fatigue, and fluid buildup around the heart. Another important condition is rheumatic fever. Rheumatic fever is an autoimmune complication of untreated strep pyogenes infection. It can lead to long-term heart valve damage, a reason strep throat should always be treated properly. Moving on to Chapter 13, Lymphatic and Systemic Infections. Let's start with the basics of the lymphatic system. The lymphatic system helps trap and filter out pathogens. Lymph nodes swell during infection because they're actively producing immune cells. A classic example of a lymphatic infection is the bubonic plague, caused by Yersinia pestis. It causes enlarged lymph nodes or buboes and is transmitted by fleas. Without treatment, it can become pneumonic or septicemic. Also, there's the Epstein-Barr virus or EBV, which causes infectious mononucleosis known as mono. It spreads through saliva and affects lymphocytes. Symptoms include fatigue, sore throat, and an enlarged spleen or lymph nodes. Next is HIV and AIDS. HIV targets CD4 T cells and weakens the immune system over time, progressing to AIDS. Patients with AIDS are vulnerable to opportunistic infections like Kaposi's sarcoma or pneumocystis pneumonia. Other pathogens that spread through the lymph or blood include cytomegalovirus, CMV, causes problems in newborns and the immunocompromised. Ebola causes hemorrhagic fever, and Toxoplasma gondii, a protozoan that can cause brain and systemic infections. Now let's talk about the nursing focus. As nurses, your role in recognizing fever patterns, abnormal heart sounds, or rapid onset symptoms can save lives. Always follow infection control guidelines, monitor vital signs closely, and advocate for timely intervention. To recap, blood infections like septicemia require rapid treatment. Cardiovascular infections like endocarditis and myocarditis need antibiotics and cardiac monitoring. Lymphatic and systemic infections range from mono to HIV and plague and require critical thinking and fast action. Thanks for watching. Don't forget to review your textbook diagrams and highlight key symptoms and pathogens in your notes. We'll go deeper into immunology and vaccines next week. See you then.